so good point. So we're not just looking for this. I mean, you'll sometimes be able to see it if it's really prevalent, but you're really going to be actually using your hands and pushing it. So you're not moving your patient, like you said, you're just going to be feeling kind of what that joint feels like. So if there's edema, they usually say it's going to feel like a soft and like boggy feeling. So yep, Chris did a great job. So we're going to go ahead and check out his PSIS. So on some people, you'll see where their PSIS is located, they'll have like a nice dimple. I like to just come in here and feel it, and it almost feels like a marble-like projection is what I compare it to. So here we have both of his PSISs, and I'm just gonna be kind of feeling. So you do have, I like to focus on, you have like an upper part of the joint, the middle of the joint, and the lower joint. So that's what we're gonna be wanting to feel. I'll use my 3 fingers to feel where any edema might be located. And he actually feels like he has a little bit of edema down below and the lower aspect of that joint. So if we remember the previous part of the video, and this is what we're going to be doing the whole time we're doing our analysis, is bringing all the pieces of information together to really point us to that one correct subluxation or how it's misaligned for our adjustment. So based on our previous, we were thinking he had an ASI in on his right. And what I'm feeling with that edema at the very base of this joint space, that also would indicate he possibly has an AS misalignment on this side. So then again, palpate the left side. We always want to palpate bilaterally. Same thing, he has edema actually at the top of the joint, which would make sense if we're thinking this might be a PI misalignment on his left side. So as it rocks down, it's gapping that space at the top of the joint, and any edema is going to pool to the area that is available for it to move to.
So now what we are going to do is talk about motion palpation. So we've now talked about visualization, we've talked about static palpation, and now we're going to talk about motion palpation, which is going to be the blueprint of our adjustment. So now with the motion palpation, I just want to go over basically the misalignments and how we're going to feel it. When we have a posterior inferior, the posterior superior iliac spine is going to rock down. When we have an AS, it's going to rock up. So I just want you to realize that when we're palpating, we want to feel that as well. So now what we're going to be doing is we're going to be rocking side to side. We're going to be rocking back and forth to kind of feel what that misalignment's at. Okay, so now I'm going to show you on a person. So first thing I'd like to do is, this is going to be a few tidbits for the younger quarters. Everybody at first wants to be pokey and proddy and all this stuff. And I have had more success and an easier, the patient's more relaxed and an easier way for me to feel relaxed and palpate by actually finding where I am at the joint and almost putting kind of the whole hand there. This feels a little pokey and proddy, to me at least. And I just feel you have a more relaxed and more control over the patient. And I also want you, this is kind of a higher level of thinking, but I also want you, when you're palpating with this hand, you're not just palpating this joint and all this stuff. You're palpating the muscular around it, everything like that. And also when you have this hand up here, you're also palpating how they're feeling above when you're rocking them back and forth. You can feel a lot from not just focusing on the sacroiliac joint. You can feel a lot from having your hand up top and feeling what's going on the bottom as well. So for the first thing that we're going to do is we're just going to rock the patient back minimally, okay? So we're going to rock it back minimally. It's not going to be a palpation when we're rocking them back like this, okay? We want to feel the first movement of the joint actually move, okay? So now what we're doing is when we rock that ilium back like this, okay, what it should be doing is rocking that ilium up. So for example, if we rock the patient back and the ilium stays where it is and doesn't rock forward, that usually can be indicative of a PI ilium. So for example, it should go forward when we rock back. And all these motion palpations, these are just another tool that we're using to find the subluxation. There's many other tools that we've shown before and we will show that will help us be as much specific, but this is just a way to help us find it. So now that we have it, we're gonna feel top of the joint, as Rachel said, middle of the joint, and bottom of the joint. So I'm relaxed here with my 3 fingers. So we're gonna rock back and always checking bilaterally, okay? Rocking back. So now that we've done that, we're now going to sway her side to side. So now my fingers are on the medial side of the PSIS and the sacrum at the same time. So if you kind of feel my fingers here on the PSIS, my finger here is on the sacrum. So now what I'm feeling is I'm going to feel it go go, and rock it back and forth. So basically what should happen on this side is the sacrum should go in. So this finger should go in, and this ilium should almost go like this. So the sacrum should fold in this way, and the ilium should go like this. You know, a lot of the motion palpation is kind of, you're trying to fix where it's stuck, but you also want to find the stuck joint in a sense. A lot of this is actually just finding which joint is stuck. And being specific in this, you can actually find which is misaligned as well. So when we rotate, when we lean towards the patient, the sacrum should go in and the ilium should go like this, okay? So for example, if we rotate this way, laterally bend this way, the sacrum should go in, and if it doesn't, it could mean a base posterior on that side, either a P-L or a P-R, or a rotated sacrum on that side. So if we're feeling this and the sacrum goes away, but this ilium doesn't come over like this way, we can also mean an EX on that side. And that's a little bit more advanced. Today, what I want you to get is basically, I want you to understand that we're feeling which joint is fixed here, okay? And we're moving, and it's a really minimal movement when we're doing this. And also another thing that I like to do is you can actually look which glute comes off the table first. Like as I was palpating Rachel, I figured that this side, there we have it come off, and then this side, a lot more delayed. So you can say that maybe there's a fixation on this side because it's not having as much contact with the table as I'm laterally bending. So basically, just to review, we're going to be on the PSIS. I want you to relax your hand. You're going to feel so much more on those fingertips being relaxed. So we're going to rock them back, okay? And then we're going to laterally bend on this side. Perfect. That sacrum should go away. That ilium should come up like this. And then also we're going to check bilaterally as well, okay? And have it rock. And now when we're palpating, you want the patient as relaxed as possible. Right now, I'm just putting my hand here. Another way for some bigger patients is I like to put my hand up here sometimes, just so I can have the patient really relaxed and I have total control over them. Even if I don't have this hand, I have total control and they're almost hugged in like that. So remember, we're rocking back, okay? We're rocking side to side. And now we're finding where the fixed joint is in a sense, in relation to the sacrum and the ilium. Okay, so now that we've talked about all the other, the visualization, the static, the motion palpation, now we're gonna talk about, once we find these misalignments using X-ray and our scope, we're gonna now basically position the patient in perfect patient positioning for a side posture move. So the first thing that we're gonna do is getting the patient on and off the table is so important, because the patient can actually injure themselves when they are getting on and off the table. And also, you just made an adjustment that you don't want to undo. So having them get up in a proper way is very, very important. And this is actually a very good tip of how you should get out of bed as well. So first thing we're going to have the patient do is we're going to have the patient sit, okay? So now we're going to have the patient stick out their arm, and this is not a pelvic bench, but we're using it as is. And we're going to have the patient stick their arm out to about the pillow length. So their arm should be at the pillow length. So Rachel's going to do this very slowly and methodically so you can actually see where she's going with this. So the first thing she's going to do is place that arm down, okay? And the next thing she's going to do is place that other arm down, and now she's going to start to rotate her foot over. So she's going to put that arm on the table and then kick up these legs and then set herself down like that, okay? So she's like that, and she already knows what to do with her legs, so that's very easy enough. Okay, so now that we have this, a very important thing is now the patient's down like this, the patient's comfortable. So what we're gonna do is I want you to bend this leg, and I want you to straighten this leg as much as possible. So a lot of people, confused of how far do I bend the leg and all this stuff. So what I do first is you can actually feel L5, and you can feel when it starts to move posterior, and that's how far you need to move the leg up, so about right there. So we have the leg in the proper position. Now you see how she's a little unbalanced right now, and I have to kind of hold her up. What you're gonna have her do is lift this leg up and then tap this buttocks, and she'll just do it for you. You don't actually have to do anything. So she's a lot more balanced now. So for this one, we're now gonna worry on the shoulder. So with this one, you're gonna first ask if the patient has any shoulder pain or anything like that. And you're almost pull down inferior and a little bit anterior, okay? And if they do have shoulder problems, you're just gonna grab up here and do the same. So the next thing is the arms. Arms are very important. I know other techniques and other things, they come up and they grip here and they crunch together. In the Gonstead technique, we distract. So we distract the spine to basically give us room to work in a sense. So we're gonna have her arm, this arm's gonna be under here, we're gonna have this arm on top, and she's gonna relax back. And then we're gonna straighten this leg out. When a patient's in perfect patient positioning, they should be able to relax like this. It shouldn't be, she shouldn't have to fight to stay up or anything like that. So now that we have a perfect patient positioning, her shoulders anterior and inferior, we don't want her shoulder too much flexed back, but just for the example, she's good right there. And also her leg isn't too kinked. And also if women have tight jeans or anything like that, you can actually roll up the jeans or scrunch up the jeans just so their knee can bend more and you can get so much more play in that leg. So now that we have him in this position, Rachel, can I have you flip over? Mm-hmm. So now what we're gonna do is, this is just a little tidbit. We're just gonna basically just show you a ilium setup real quick. So we're gonna do a basic PI just for fun. So now that Rachel, we're gonna do the same perfect patient position. She sits on the table, okay? So now what we're gonna do is we're gonna find that sweet spot, keep it right there. We're gonna have her, remember the chiropractic's back is the most important back. So we're gonna have her come this way, lift this leg up, and then scoot this way. Perfect. And then we're going to come here with the shoulder, anterior and inferior. Perfect. So now that she's relaxed, everything's good. So the second that I come up to the patient, I want the patient to feel secure, that I'm in a secure motion. So I'm actually gonna put my legs over her legs in a V, okay? Now that she's good, I can actually control this leg and feel different things. I can actually palpate with this leg, and now she feels controlled where she's not gonna fall. So the first thing, and we're gonna have other videos where this is explained, but basically what I want you to do is, it's almost a dance. Like I actually call it, this is my dance, I'm ready to dance. So basically what we're gonna do is we're going to find our contact. So for a PI, and we're doing skin on skin, by the way, we're finding that posterior superior iliac spine. We're going to tissue pull up, okay? And with a soft hand, very, very soft hand. If you're gonna see my hand, it's gonna be able to be movable and very soft. Come in. See how soft? Just a small contact, doesn't have to be too hard. So now that I have that, I'm keeping my back up straight, everything like that. Now I'm going to actually take my stabilization hand. So now we have, like in cervical chair, we have 3 points of stabilization. Contact hand, stabilization hand, and my legs, okay? So now what we're gonna do is, with this hand piece, the humerus is back, so my hand just fits in there and I can just push out a little bit, okay? So now what we're gonna do is we're gonna kind of step back and we're gonna lower Rachel very slowly, okay? So we're gonna see how she's rolling over in a unit. This side isn't rolling over than the shoulder, so we're gonna roll over this way, okay? And then come in right here, drop my foot back, leg up high, okay? So now that we have her like here, the set is really small. So literally it's not a big gross manipulation or anything. It's a lift with the arm and then a stabilization into the leg. So it's a lift with the arm, stabilization with the leg. Lift with the arm, stabilization with the leg. Okay, now that we've shown you that mock setup for an adjustment, we now want to show the importance of getting the patient up and off of the table. Because now that you made that awesome adjustment, we don't want to undo the adjustment, and we want them to get in the proper position so they don't injure themselves and also misalign themselves again. So as Rachel's going to show, I am not going to help her get up because she needs to use her own weight, and if I help her, it can sometimes cause her to injure herself. So Rachel is now going to use her arm to push herself up, okay, this way. Now that she's like this, she's going to kick her feet out and sit up, walk herself up, and now she's up, and now she's going to push up to get up by herself. Awesome. Thank you so much, by the way. We really enjoyed making this video, and we hope this helps whoever we can, and we just want to say we're very passionate about chiropractic, and we're very passionate about principled chiropractic, and we just want to keep spreading the word of chiropractic to as many people as we can. My name is Chris Outen, and this is...
I'm Rachel, and we hope to get you guys back in person soon. We hope these videos are going to really get you guys ahead of the game and jump started well. But it's nothing like getting back in person, so we hope to do that soon and see you
All right.
guys there.
See you guys later.
Bye.